Hi everyone, and welcome to this gentle guide for your first steps in post-surgery breast cancer recovery. Now, I had surgery 2 days ago and was provided with a leaflet by my discharge physiotherapist, which was created by Breast Cancer Care. Today we'll be focusing on the initial exercises in this leaflet to help retain mobility and reduce stiffness after breast cancer surgery. My surgery was actually in the axilla. So I'll be using these exercises in my first week of recovery before moving on to the more advanced exercises which are held in that leaflet. The most important thing is to listen to your body. Every day is different and every healing journey is unique. And remember, consult with your healthcare team professionals before starting any exercise program. So before we begin, let's just do a quick upper body check. This is your moment to connect with yourself. Start by noticing your breath. Is it shallow or is it deep? Is it relaxed? How do your shoulders feel today? Any tightness? Check your neck. How does it feel when you rotate it? How does it feel when you move it? And most importantly, check in with your surgical site. Do you feel any unusual sensations, any sharp pain? Also take note of anything around the scar site. Is there any excess swelling, any infection or healing issues? You are your own expert, but if you're in doubt, please check with your team. So remember, we're aiming for gentle stretching, not pain. And if you feel any pain, please just stop. Pain is a signal we shouldn't ignore, and listening to your body is what it tells you is really important. Always stop if you feel sharp pain, and if your pain persists, contact your healthcare team. I'm not very good at counting exercise. I listen to my body. But if you aim for about 5 of each exercise 3 times a day, it's a great start. Don't worry if you miss it or if your body is asking for a break. Just try and be consistent, but also be kind to yourself. And if you really struggle, reach out for help from your breast care nurse or your physiotherapist. Our first couple of exercises will be a warm-up, and we'll also use them for the cool down. So we're going to start with gentle shoulder shrugs. So bring the shoulders up to the ears and lower gently. Good. And the second exercise is shoulder rolls. This can help release the tension in the upper back and the neck. And don't worry if you go forwards first or you go backwards, but we will be doing both. So we're just gently rolling those shoulders, lifting up towards our ears, and then rolling them either forwards or backwards. Keep these movements small and comfortable, and repeat them in both directions. On from our basic exercises, which will warm our body up, we're going to go with our initial exercises. So we're going to bend our arm forward, and you'll rest your hands on your shoulders. I'm going to take your elbows up to shoulder level and down. So they're bringing those elbows up to point to the front and then down to the ground. These are really small movements and gradually only increasing when you feel comfortable. And remember, no pain. We're now going to take those arms sideways, keeping the hands on the shoulder. I'm going to raise and lower, again listening to your surgical sites, listening to your body. Just getting your elbows to come in line with your shoulders if you can, and then lower them. Always listening. Good work. Really nice. So the next one is back scratching. Now with this one I'm going to turn around, and I bet it's a really good functional exercise for you. So we're going to take the arms out to the sides, and then we're going to very gently lift and lower. Now to begin with, I couldn't do this with both arms, so I'm 2 days in and now I can do it with both arms. But if you can, do it with both arms. If you can't, just take one arm at a time and do it in a singular movement. Okay, good work. And the final exercise in this mini set is winging it. So it's another great mobility exercise. We're going to take our hands just behind our head, and again, keep listening to that body. I don't want to open up as much as I should do, so I'm just going to bring my hands a little bit, my elbows a little bit further forward. So what we want to do is actually open up just by stretching the elbows backwards and then closing. Open up and close. Now my body is saying, oof, that's a little bit too much, so I'm not going to push it too far. And now we're going to come back to shoulder shrugs and shoulder rolls. So we're going to just do some rolls to cool down, forwards forwards and backwards, as many as you feel is necessary for you. And then the shrugs. So it's nice and quick and easy, okay? And we can fit this into our day-to-day life. But it's a great job. Let's take a moment just to breathe and feel your body. How does it feel now? And notice how it feels later. So we're going to take a deep breath in and breathe out. And remember, this is just the first set of gentle movements. Consistency is key, but so is patience and your own compassion. If it doesn't feel right, just stop. If you're unsure about any exercise or experience new or worsening symptoms, please contact your team. But remember, you're doing great. Recovery is a marathon, not a sprint, and you are unique. Your journey is unique, your surgery is unique, and your rehabilitation is unique. So thank you for taking the time to watch today, and good luck in your recovery.